Hello everyone, I am Dr. Pradheep Rachakonda. I am a consultant cardiac surgeon at Continental Hospital, Hyderabad. Today I am going to talk a little bit about minimally invasive cardiac surgery. So you all might have heard of minimally invasive in other parts like laparoscopic surgery, etc. So now cardiac surgery has undergone advancements that today it is possible to do even open heart surgeries through small incisions. Conventionally, open heart surgery is done from the center of the chest. We cut the breastbone, open the chest and go to the heart and fix the heart. Various open heart procedures we do like coronary artery bypass, valve repairs, valve replacement, etc. So the disadvantages with the big incision is that one is pain. Patients after surgery, they have some difficulty in breathing. The bone takes a long time to heal and the blood loss is slightly more, etc. So nowadays we have progressed with the little advancements with all the latest equipments and instruments. So what we do, we make small incision either in the right side of the chest or in the left side between the ribs, about 2 to 3 inches long, and try to approach the heart from the side without cutting the breastbone. So that is called minimally invasive cardiac surgery. So what are all the procedures that can be done through minimally invasive cardiac surgery? Any kind of procedure that can be done with the midline incision can be done through the small incision, except for a few procedures where there are multiple risk factors and complicated anatomy, etc. So normally we put the patient on heart-lung machine, stop the heart and try to replace the valve, etc. So in minimally invasive cardiac surgery, we make about a small incision in the groin to look for the femoral blood vessels where tubes are placed to put the patient on heart-lung machine, and then we make another 2 inch to 2.5 inch incision between the ribs on the side of the chest, and then we approach the heart from the side. Similarly, it is also possible to do bypass operation through a small incision. We make a small incision on the left side of the chest to approach the blood vessel. We take vein from the leg and another artery from the inside of the chest, and through this small incision we have special instruments which are long and thin that will help us go through the small incision. We do it either under direct visualization or sometimes with the aid of a long camera. So what are the advantages of minimally invasive cardiac surgery? One main advantage is the shorter recovery time. Typically patients have lesser pain and they do not have to be ventilated for a longer duration as with conventional open heart surgery. So patients are usually separated from the ventilator the same day, very rarely the next day, and they stay in the ICU slightly shorter when compared to conventional open heart surgery. On the whole, their hospital stay is shorter by a few days and they get discharged quickly. The requirement for blood transfusion is also less, and the overall pain that they experience is also less, and their return to work is quicker. So these are the advantages of minimally invasive cardiac operation. Less stay in the ICU, less hospital stay, lesser pain, lesser need for blood products, lesser time on the ventilator, and overall earlier recovery and earlier return to their work. So nowadays we are able to do procedures like mitral valve repair, mitral valve replacement. For aortic valve also can be repaired or replaced through another small incision here on the right side of the chest. Coronary artery bypass can be done. Sometimes for difficult vessels, we do what is called a hybrid approach, where a patient, suppose he is having multiple blockages like 3 or 4, 2 blockages will be addressed through bypass operation, where we do the bypass, and the blockage which cannot be done through small incision, the cardiologist will then see those in the cath lab and do a stenting. So it is called a hybrid approach because it is a combination of surgery and stenting. We have all the facilities and features to do minimally invasive cardiac surgery, and more patients are preferring the minimally invasive approach when compared to the conventional open heart surgery through a median sternotomy. Thank you.